All right, well, welcome. I know tonight we talked about the topic of this workshop being vital needs. We're going to get there, but to lead us into that topic, I want to talk about the difference between cause-centered care versus effects-centered care. And why do I want to start the conversation off here? Here's why. Back in 2018, there was a study conducted at the University of North Carolina, and it revealed that 88% of the US adult population was at risk for chronic disease. 88%, that's almost 9 out of 10 people. So that means a small sliver of the adult population meets the criteria for metabolic health. And that is defined as optimal blood pressure, blood sugar, HDL, cholesterol, body mass, and triglyceride levels without resorting to medications. So 88% of the US population is at risk for chronic disease. This was back in 2018. What happened last year with the pandemic? And how did the US fare with the coronavirus? Not so well. In fact, 94% of people who passed of coronavirus had up to 4 comorbidities. So when you're talking about almost 9 out of 10 people having poor metabolic health, being at risk for chronic disease, we've got to take a look at what is our healthcare system, how are we utilizing our healthcare, and what are we doing on a daily basis to support our health. Okay, so that's where I really want to dive into looking at how do we use healthcare and what is the model. But before we go there, I want to talk about what are the causes of these things. Okay. Low back pain. You guys can type in, or if you feel like, Zach, I'm going to, because I can see you, Zach, if you feel like you want to chime in at any point, you're welcome to. This can really be a conversation. But what causes low back pain? Is there anything, and I can certainly start.
Stress, I would say.
Stress?
Either physical or mental.
Absolutely. I love that. Zach, you're like the favorite chiropractic student here, because our founder said, what causes breakdown in the body? What causes disease? And he said, there's stress, and there's 3 types of stress, the 3 T's: traumas, toxins, and thoughts. So you said physical or mental, so traumas or thoughts. But low back pain, so we have physical stress, right? That could be a lifting injury. It could be malalignment. I mean, we estimate that kids have fallen 5,000 to 6,000 times by the time they're 4 or 5 years old, right? So if we've got malalignment or structural stress going on through our bodies, and we continue to grow with that structural stress over time, we can get low back pain. Low back pain is one of the main or leading causes of people taking time off of work. So what causes arthritis? Arthritis can fit right into low back pain. Typically, for osteoarthritis or degenerative joint disease to present on x-ray, it's estimated that it's been around between 5 and 30 years. So it's been around a long time by the time we start to see arthritic changes taking place in the spine. Majority of arthritis is a degenerative process. Yes, you can have inflammatory arthritises like rheumatoid arthritis. Let's see, what would be another one? Psoriatic arthritis, those are inflammatory in nature. Majority of them that we deal with are degenerative in nature. So what causes cardiovascular disease? So if you talk to anybody, they say, well, if you look at the stats, the leading cause of death in the US is heart disease, which is cardiovascular disease, right? So that's where we look at what are the stresses, how are we feeding us? We look at nutrition. Do we have an inflammatory diet? How are we carrying weight, right? Are we, and again, I guess, do we have high blood pressure? Stress the cardiovascular system, but what causes that? We go back to what supports a metabolically healthy person. Typically with cardiovascular health, I mean, the first symptom we get that we have cardiovascular disease is a heart attack, right? And it kills most people. So what do we do in this country in terms of our healthcare? We look at symptom-based care. We look at effects-based care until we do anything. And so if our first symptom is a heart attack, then guess what? We've missed something here. And so that's where we really need to shift and change our lens and how we view and approach health on a daily basis, because cardiovascular disease happens over a long period of time. Cancer, typically breast cancer, it's around for 10 to 12 years before it's large enough for us to identify under a microscope. So it's been around for a decade and years. Cancer, there's a big stigma when it comes to that word, but cancer is abnormal cell growth. And we have abnormal cell growth happening in our bodies all the time. It's just when it becomes a process where it proliferates and it gets bigger and bigger and takes over, and your immune system is suppressed or not functioning appropriately, that it can't take care of those cells. So what causes cancer? You can look at lifestyle pieces again, with our physical health, our nutritional health, how we manage stress. Obesity, again, we don't wake up one morning and we're 100 pounds overweight, right? This happens over years and decades. Diabetes can say the same thing. Alzheimer's, I mean, if you look at the research, they're actually looking at, there's 3 types of Alzheimer's. One, it could be a result of toxic exposure to mold. That's typically type 3 Alzheimer's. That happens in somebody who doesn't necessarily fit the criteria of an older adult that we're seeing dementia and then moving into Alzheimer's where we see plaquing going on in the brain. So type 2 Alzheimer's is what they're actually calling type 3 diabetes. So it's lifestyle, again, lifestyle behaviors and activities. And then you have the type 1 Alzheimer's, which is older age, plaquing, and I don't know if they really understand where that comes from. So we talk about what causes these things. Now, what is our healthcare system doing to provide care for these things? Okay, so when we go here, I want you just to think about our healthcare system. It's considered an allopathic model, and allopathic also, it falls under the umbrella of pathogenesis, which is the study or the birth of disease. What causes disease? And so when you're really focused on disease, how do you know you have a disease? Typically, symptoms present, right? So under our allopathic model of our current healthcare system, we're really focused on, is there symptoms or are there not? And if they're not symptoms, then there's no reason for you to present at one of our healthcare facilities. So it's really looking for, I have a symptom. What happens then? I go into the doctor. The doctor takes a case history, really understands, your health history, the symptoms, when the symptoms occur, what triggers the symptoms. I mean, they want to know everything about the symptom. And then they do an examination to determine, right? And that could be labs. It could be different diagnostics. In a chiropractic exam, we're looking at ranges of motion. Chiropractic palpation, we're looking at heart rate variability. We're looking at how you're distributing your weight. More in a healthcare facility, they could run blood labs, panel. They look at how your thyroid is functioning, how your liver is functioning. Look at EKG. They do urinalyses, right? Different types of examinations depending on what the symptoms are. And based on that case history, based on the exam, they're really looking at a differential diagnosis, right? You could have this, you could have this, you could have this. And if he has this, then we're going to look at treatment. And that treatment is specific to reducing the symptoms of differential diagnosis number 1. And typically reduction of symptoms, if it's pain-based, it's pain meds, anti-inflammatories. It is muscle relaxers in terms of, say, a low back pain, arthritic type symptom. If it's cardiovascular disease, they're looking at blood pressure. So they want to reduce the blood pressure. They're looking at cholesterol. So they look at maybe a statin, right? If it's sick, they want to give you an antibiotic. If it's viral, they're looking at different types of options, but it's all treatment designed to relieve the symptoms. And if it relieves the symptoms, then guess what? We have succeeded in the proper diagnosis, and we have done our job in terms of effects-based care. So how's that doing for us right now? Right? 88% of the United States. Oh yeah, Zach, go ahead. Tell me, how's it doing for us right now?
It's okay. You know, just kind of sucks having to take muscle relaxers every day and night.
Right. So for you personally, you know, you've had to go through this model because you're in acute pain, right? It's okay for if your house is on fire, who do you call? Right? You're calling the firefighters. But if you have a foundation problem, you don't want to call the guys who are coming in for emergency type situation. And when it comes to chronic disease and things that cardiovascular disease, diabetes, obesity, you know, depending on the type of Alzheimer's, when you're talking about these types of conditions, which are considered chronic disease, when we have 88% of the adult population at risk for chronic disease, when we are spending the most healthcare dollars in this country per capita, and yet we are the last in terms of health outcomes in all of the industrialized countries, we're not doing so good, right? Something has got to change. So really focusing on symptoms as a way to gauge your health is not really a good gauge at all, right? And if we've done that from a very young age, starting with, you know, say earaches, ear infections, right? What do? They put in tubes. They want to treat the ear infection, but not look at why is the ear infection there in the first place. So we've got ear infections, we do tubes, and we got antibiotics, and now we've got a child who gets sick frequently, so they're on significant medications. Now they have asthma because their body isn't appropriately processing their environment. So if it starts at a very young age, you add 20, 30 years to that, you're talking about foundationally a very unhealthy person. And so when we look at our current healthcare system, I would say we're doing a pretty crappy job in addressing true health. But we're doing a real good job of treating a symptom and creating a differential diagnosis to, you know, take care of and treat that symptom. Because if it's not this, then we go to the next one on the list and we look at what's the appropriate treatment for that. So let's, any questions on that? Zach, I can only see you. So, and I think you're the only one with a speaker that works, but any questions? Are you good?
I think I'm all good on that.
Cool.
But thank you.
So let's talk about this a little bit more. So there are two different models of healthcare in our country. We just talked about the allopathic model. It is pathogenic model. There's also the salutogenic model, okay, which is typically alternative healthcare where that falls into play. So that is chiropractic, that is acupuncture, that is massage therapy, that is Reiki, that is naturopathy and homeopathy. PT, so physical therapists can fall into this model, but they tend to fall more into pathogenic model to really treat a specific symptom. So what's the difference? Again, with the starting point of, so let's go back to the salutogenic model. Salutogenesis basically means the birth of health. And really when salutogenesis, it's the questions around what is keeping this person from expressing their fullest potential? What is keeping this person from being vitalistically healthy, okay? Versus a pathogenic model, which is what's causing the disease and how do we get rid of the disease, okay? Very two different models, different lenses in which treatment or care is rendered. But you've got to understand that you're going to get different types of outcomes within each of these models. And so the question is, how are you utilizing these models for your healthcare? So let's just take low back pain as an example, okay? So if you walk into, say, an allopathic model, so you go to, say, a general practitioner, and you've got low back pain, their starting point is, what is the disease or what is the problem? So they have low back pain, right?
Mm-hmm.
the goal is to, first of all, remedy the back pain, but then also prevent, future back pain from happening. And so they want to eliminate risk factors. So again, I think it's great to eliminate risk factors. They're looking at what are the stressors, right? They may discuss stressors related to your low back pain. But the goal and the perspective ultimately is to treat the low back pain. And the way they treat the low back pain is to prevent pain, keep it from getting worse, and to minimize the problem. And typically when you're in this model, it's very fear-based because you are scared of what's going on in your body, right? I have low back pain, I can't move, I'm scared, it's starting to progress down my legs, starting to cause weakness, right? I'm scared. So it's a very different lens. Typically, the treatment is delivered per event or per episode. So once it's resolved, then they say you're good to go. We don't need to see you anymore. So again, the outcome is the absence of the problem. And you reactivate into this model is when the signs or symptoms show up again. And the role in terms of the doctor-patient role, it tends to be pretty dominant, where doctor tells you what to do, the patient follows that model. Versus a salutogenic model, where you're looking at the starting point, again, is what is keeping this person from being healthy? So why does this person have low back pain? And what is keeping their back from moving appropriately? Why is their body in a state of restriction and tightness? Let's identify what's going on to support and maximize this person's ability to express health. And we want to create health factors. So we want to support healthy movement and exercise. We want to identify the stress and start implementing appropriate stress management tools, appropriate movement, appropriate lifestyle management tools to help support you obtaining health. Because when you are healthy, guess what? The side effect is the symptoms go away. Because why? Symptoms are a way for your brain and your body to tell us there's something going on. But the focus is to promote growth, to see continual improvement, and again, to continually optimize what your potential is. And so in this model, generally people feel pretty empowered because they think I can do something. I can change and I can support a different trajectory in terms of what I'm experiencing now, and I'm not defined by this, and I don't have to be in low back pain for the rest of my life. However, this is not event and episodic in nature. This is something that is viewed as a process and something that we anticipate a lifetime for you to continually to work to experience potential. So we're looking at you gaining better movement, better function, and it's really looked at as a partnership, right? Coach, you working together, because guess what? In terms of chiropractic, this is your spine, this is your low back pain, this is your problem. I didn't do this to you, right? You did this to yourself. So this is something that you need to do, and I can give you guidance and support through the process, but ultimately the person who has to do it is you. So it can be really empowering. Right? But it's not easy because there's no magic pill when it comes to health and well-being. And I think the allopathic model has really done a really great job of providing a magic pill that gives you instant response, instant relief, but it doesn't necessarily support, overall health and well-being down the road. So there is a difference when you walk into different healthcare facilities. And I would challenge you, when you're thinking about your own health and your own well-being, how are you utilizing your healthcare? And if you're going to your general practitioner, understand they are functioning in a specific model. So they're really looking at a problem and resolving that problem, right? But the bigger picture is there's a reason that's there in the first place, and you don't want just resolution. You want to make sure that foundationally you are doing things that support overall health and well-being in the long run, right? Because if majority of people really choosing to be proactive about their health, probably not 8 to 9 out of 10 of them wouldn't have metabolic disease and wouldn't be considered at risk for chronic disease, right? And we'd be spending a lot more healthcare dollars as a whole in terms of the US. Okay, questions on that? Zach, I'm gonna go to you because you're my guy. Or any takeaways? I would love to know, as you heard the differences between pathogenesis and salutogenesis, if you feel so inclined, I would love to know your, just your thoughts.
I don't really have much. Sorry.
That's okay. That's all good. I'm glad you're here.
Cool.
Because when you do those, let's just talk about low back pain. When you do those wobble movements, that is supporting a healthier movement, healthier discs, and healthier lumbar spine, right? So let's get into the vital needs then. So this is really understanding the importance of there are vital needs, there are essentials needed for life, right? If you don't have these essentials, it basically means death. So at the base of this triangle, when you're looking at essentials and what is essential for life, we say food. Food is absolutely vital, right? If you take food away, or if you don't have food, oftentimes depending on who you are, depending on where you are, depending on how your body mass index, typically we can't survive longer than weeks, 3 weeks for some. Gandhi, I think, charted at around maybe, I don't know if it's 40 or 60 days, but if we do not have food, then we die, right? So food is considered an essential. But what is more important than food in this vital needs triangle? What is more essential? That if taken away,
water.
What's that? Water?
Water.
Water. I agree. Yes, it is water. So water, how long can you live without water? Typically it's days. Again, depends on where you are. If you live in a desert climate, it's arid, maybe you live 2 to 3 days. Maybe it's longer, but typically it's days. So I want you to think about this, because water is, compared to food, if you remove water from the system, it could be more detrimental in taking away life. But if you have food and water present, it can be more restorative in terms of bringing life to somebody when you look at the hierarchy. So an example, let's say you're walking around, I don't know, hiking, and you're out in an arid climate and you come across somebody, right? Are you going to, and let's say they're comatose, right? You're like, how can I assess and evaluate their health and their needs right now? Are you going to say, I think they need food, I'm going to give them a granola bar and check and see if they had supplementation? Or are you going to say, no, I think we need to make sure this person is hydrated, I'm going to give them water. Maybe give them water in capfuls or tablespoonfuls over time to help nourish their body, right? So in terms of vital needs, what is going to restore life more quickly is going to be water over food. Both are critical, no question, right? So what is going to restore life more quickly than water? We've got air or oxygen, right? So we can typically live without oxygen for minutes, 5 minutes, 6 minutes. There have been occasions where people have come back after 6 minutes. But typically, EMS comes on the scene, there's major trauma, they're triaging to evaluate if there is blocked airways, right? Somebody is choking on something, you're not gonna say, oh, you need some water. No, you need to get rid of the blocked airway so you can have oxygen, right? Brain needs oxygen. So what is more essential than food, water, and oxygen? That's where chiropractors, that's really where I love doing what I do, because we work with the brain and nervous system. If you cut off that spinal cord, you sever that brain body connection, it is instantaneous. Life ends. right? And so I love these conversations that I have in the office because we get into some good ones. All of these are critical. They're all critical, no question that they are important. But when you talk about what is going to restore life in the most efficient, fastest possible way, you look at this hierarchy. So you're always going to want oxygen over water, water over food. But you always want a good brain-body connection. Same way of thinking about it is what's going to take life away quickly, right? And so people love to talk about the importance of food and supplementation. I will not argue that ever because it is so important, right? But in terms of immediacy and life, you've got to have these three up top, before you have food, right? And when you do all of these things, guess what? You more synergistically work and express a higher potential in terms of your health. If we were to add one here, I would add sleep. Sleep is vital. I think they've done some studies where they said 11 days. So how long? 11 days without sleep and you've got death, right? So if we were to add to this vital needs chart. So as you look at this vital needs chart and really are in this conversation, I just want you to think about, how are you utilizing your healthcare, right? What are you choosing to do on a daily basis that supports your expression of health, right? Are you supporting all of these hierarchies that are essential and then some, right? What is the healthcare that you're utilizing? So that ends my time. It is 6, I think I went over. So it's 6:16. But I hope that this has given you a lens to really assess your choices that you're making around your healthcare. Because what you choose to do now will impact your life for years and decades to come, right? And it's really important. So I love that you guys are getting adjusted. I love that you are under care, because when you start from the top down, it's immediate. Your body and brain is significantly more efficient in terms of how it responds to your daily world. So you guys are awesome. Thanks for tuning in. Zach, thanks for being on video so I can see your face. It's great. And I'll see you guys in the office later this week.
Thank you.
Thanks, Zach. Appreciate it.